Tonight. Our first presenter is Miss Rachel Honore Young, who is a pediatric family nurse practitioner at the Our Lady of the Lake Children's Hospital. We also tonight have Dr. Yash Shah, who is the clinic director at Our Lady of the Lake Children's and is a board certified neurologist. We also are very excited tonight to have Mr. Braylon Brown and his mom, Dion, who will wrap up the rest of our webinar, sharing a little bit of a personal story of how this relates to students with epilepsy. So we're going to start with you, Rachel, and thanks again for joining us.
Thank you. Thank you. Good evening, everyone. So she's mentioned, I'm Rachel Honore Young. I'm the nurse practitioner here in the clinic at Our Lady of the Lake Children's Hospital. And I'm just gonna kind of go over some back to school seizure preparedness items with everyone tonight. So thank you for having me. Next slide. All right, so here's a quote from Mr. Alexander Graham Bell that states, "Before anything else, preparation is the key." So we're going to talk about a little warrior named Duncan and how Duncan's family can prepare him back to school with the appropriate seizure action plan, accommodations, and things like that that he may need. And so a little bit about our little boy, Duncan. He's a little 8-year-old boy who first started having seizures at the age of 2 years old, secondary to brain malformation. And now Duncan's in the 3rd grade, and he has several types of seizures. The first type, he has generalized tonic-clonic seizures, and these seizures sometimes come in clusters over 3 to 4 minutes, maybe within an hour, and these are pretty frequent, occurring once a week. And he has a second type of seizure, which are generalized tonic-clonic seizures. These are not as frequent, kind of happening once a month, lasting maybe 2 to 3 minutes, but sometimes it can last up to 5 minutes. And the third type of seizure that he has or staring episodes, also known as absence seizures, and these occur a few times a month. So 3 different types of seizures. Something's happening every week, maybe every other day or so, but how can we prepare Duncan to get back to school? So for the first 2 types of seizures, these are a little longer, so they're requiring rescue medications, whereas the third type of seizure may not require rescue medication. And so we want to know, okay, what are his triggers? Some of his triggers are sleep deprivation and flickering lights. So what can we do to keep Duncan's family safe, or to keep Duncan safe and happy at school? So there's a few things that we can do to customize or individualize Duncan's plan at school. That includes general precautions, safety with exercise and sports, special accommodations, and the big seizure action plan. Next. So because we already know what type of seizures he had, there are some general precautions that we want to make sure are in place, not only at school, but also wherever, if he's at camp after school or camp during the summer, things that he's, when he's with people most frequently, need to know about these precautions. So some things, we know that flickering lights can trigger his seizure. So we want to avoid strobe lights. So if there's an activity at school that requires lights to be flicked on and off, or strobe lights, we need to make sure that he's protected from that, so that he does not, or so that a seizure isn't triggered. Because of those tonic-clonic seizures, we want to make sure that, or even absence seizures, that he avoids heights at all costs. If he was to happen to have a seizure and fall to the ground, that could be very traumatic. We want to limit heat exposure, and of course, limit that screen time. Things that can, again, trigger or cause traumatic recourse if he were to have a seizure while doing those things. Next slide. Perfect. And so when we talk about sports, there are a lot of kids, they want to participate in multiple different sports at school, some more safe than others. But there are different groups of risk or sports depending on the risk where they have no significant or additional risk up to more high risk activities like climbing, aviation, water sports. So when it comes to water safety, we want to make sure that there's proper supervision. If they have to take showers at school or swimming at school, if they have an after school activity where if they go swimming, we want to make sure that they're supervised at all time. And of course, at home or at grandma's house, want to make sure that they're taking showers. And I always tell my kids, my older teenagers too, hey, if you want to take a bath, mom or daddy got to be there, because we want to make sure we provide an appropriate or safety measures for that child. Next. And then, of course, after 12 months of seizure freedom, they are able to participate in all of those different activities. Next slide. Okay, so here we talk about special accommodations at school. I'm gonna kind of highlight or talk about each one of these. The first thing is bus safety, but not only bus safety, safety at school. We want to make sure that the bus driver or anyone, any personnel who is familiar with this child, who is around this child most frequently, have a copy of the seizure action plan. And we'll get it again, I'll get into the seizure action plan shortly. But we also want to make sure that schools are aware that an unlicensed individual, they are able to administer rescue medications for a child who is having a seizure. We just want to make sure that they're properly trained, and that can be done through the parent or just, some of the, like Valtoco, some of them, they provide educational pamphlets that tells them how to administer that medication. And we want to know when to appropriately and administer that medication. And so I'm going to skip over the seizure action plan for just a second, because I want to talk about a 504 and IEP plan. These are going to be vary from state to state. The type of accommodations that are provided vary from state to state, school to school, public school versus non-public school. But the IEP in particular is a plan that is special, that provides specialized educational needs for a child. So it outlines specific goals and objectives for them to receive specialized care at school, whether it's a therapy. Some patients have epilepsy, that are refractory epilepsy, that may require them, cause them to have some debilitating things, and they require therapies. Whereas the 504 plan, which I think a lot of patients have, is more so for accommodation. So a child with absence seizures may need extended time, or any type of seizure for that matter. They may need extended time for test taking or for homework. So those are the two different things that you want to talk to your school about. Get with people appraisal, whoever does those type of evaluations in the schools, to see which one is more appropriate for your child. I know here, and Stephanie, don't quote me on everything, but I know Stephanie, who is one of our advocates here with the Epilepsy Alliance, she has gone into the schools sometimes with the parents to kind of help them navigate that, to make sure that their child is receiving the appropriate accommodations at school. So again, just check with your school to see what's more appropriate for your child. And then we move on to the seizure action plan. Next slide. And so the seizure action plan, every person with epilepsy should have some type of rescue therapy, whether it's Diastat, the Klonopin tablets, or some type of rescue nasal spray. And every child should have a seizure action plan. And the purpose of that seizure action plan is specifically for school teachers, nurses, coaches, or whoever that child is with the most, whoever's supervising that child. It gives them a guide to allow them to know when should they call, for rescue or for 911, or when should they use the rescue medication, or what should they do if that child has a seizure, what triggers that child may have. So, we typically tell patients like, hey, make sure you have a couple copies of this, or parents have a couple of copies of this. Keep one with you, mom. Make sure the child has one in their backpack. One should be kept in the school with the school nurse. There are some schools in our district, not sure, other places, that may not necessarily have a nurse. There should be some type of medical log and file at school where these seizure action plans can be placed. You can easily get one from off the Epilepsy Alliance America website. This is where I get it from my patients. I generally do most of the seizure action plans for patients in our clinic. And I like it too because it's a PDF form. You can go in and type in it, print it out, and sign it. But this is something that you would get from the neurologist or whoever's managing that child's epilepsy. Next slide. And so on a seizure action plan, there are several things on here that, and it's a very quick but detailed form that tells you, again, outlines that first aid of what to do if a child has a seizure. So the standard care that's needed for all patients, I generally say yes, yes, yes for all of these things. We should make sure that they know to time the seizure. Time in the seizure will allow us to know, okay, well, hey, it's at 3 minutes. Should we be using the rescue medication? It's at 5 minutes, whatever is indicated by your provider. As far as the duration of the seizure, when to use that rescue medication. Make sure we're keeping that patient safe, protecting their head, not restricting them, allowing them to have the seizure, and making sure we stay with that person to continue to monitor them and keeping record or a log of that total event. And I'll kind of back up, not really sure how the schools, if they are able to do this in school, but we do tell parents, hey, if that child has a seizure, if they're protected, record the seizure if you can, because that gives us providers more information of what that seizure actually looked like. Next slide. So here's an example of the seizure action plan. This is Little Duncan Warrior seizure action plan. Again, very simple yet detailed enough for those individuals to know what to look for. Again, sometimes we may not necessarily know what that child's triggers are. A lot of times it could be, illness, fever, sleep deprivation, flickering lights. So we want to annotate that we do annotate that on that seizure action plan. And there's a little pictures of what the different types of seizures may look like. We'll, check those boxes. And then further down on the seizure action plan, we do also annotate when to provide that, when to use that rescue medication. Here for Little Duncan, it says for seizures greater than 3 to 5 minutes. One thing that we're kind of seeing here in a couple districts around us, that now they don't want that range of time. They want to either see 3 minutes or 5 minutes. So we're having to be more specific on these seizure action plans, when to administer that medication and when to call for help. And then the last thing, again, I just want to reiterate, keeping the seizure action plan with you at all times. If you do not have one, make sure you reach out to your provider, whoever's managing your child's epilepsy, to get one of these seizure action plans, again, to keep with that child at all time. Put one in a central location in your home. If you have a nanny, make sure they're aware of it. Make sure that they feel comfortable and that child feels comfortable as well. We always, want to make sure that that child's included as well, so that they are aware, hey, I have a seizure action plan in place, because sometimes I have kids who are more, advocates for themselves. So make sure your child knows what's going on and the purpose of this seizure action plan. And also, if they're going to camps over the summer, make sure that they have this seizure action plan along with whatever type of medication that they use. And one other thing I'll point out, it does specify like where to administer the medication. Sometimes someone who's unfamiliar with the medication, they may not know, okay, well, does this go, the rectal or intranasal or oral, because there is an oral tablet that is also used for to stop seizures. So we also want to make sure that that's appropriately checked off on the seizure action plan as well. And that's it for that.
All right. Thank you so much, Rachel, for helping us, understand how we can better start the year. And it looks like I didn't see any questions in the chat.